because we can't just leave it up to caregivers. I mean, caregivers are amazing people and they'll do it because they care about their right? They are.
Dude, if I ever started an army,
right?
I got caregivers, man.
Absolutely.
Because they will go through the trenches. They're better than FBI agents. They will find some stuff.
100%.
But they shouldn't have to be.
They shouldn't have to. They shouldn't have to be the primary care provider when their kiddo is in crisis. We should have a system that's responsive to that.
Where can we find some hope in this?
Yeah. So some of the work that we're doing in the lab is really trying to understand how we can get better as clinicians to identify suicide in people with FASD. Because some of our work has shown that there's no commonly used tools like screeners out there to identify risk of suicide. So a clinician doesn't really know, when should I be taking this seriously and when should I not? And I think that that's the part that we want to really focus on, is giving our clinicians the tools to really be able to understand how do we best assess for this. Because once we have a sense of that, then we can think about, where do they go? Do they need to go to inpatient? Do they need to go to emergency? Can we send them home with some resources and then be able to create those resources?
So are there any, I know you talked about the toolkit, and that was really good about self-identifying. Are there any other resources that could be helpful for the parents? Because, it's like easy for you to say, Dr. McMorris, you're there, right? But I'm pissing my pants because I got,
So what I will say, good news, bad news story there.
Fair. That's okay.
And so I think right now the way that the literature is and our clinical practice is that there's not that much resources that are available.
Yeah, well, it's good to know, because as, poopy as that might sound sometimes, but now caregivers know nobody's holding anything back.